So after taking the leadership skills questionnaire, I found that I scored high in the range, in the high range for administrative and conceptual skills, and I scored in the very high range for interpersonal skills. Um, wasn't too surprised by these results because I'm really strong with my relationship skills and communication and personal skills, but when it comes to more of the bureaucracy or filling out forms, creating staffing and resource allocation, that sort of stuff, I think that I have some room for improvement. In terms of functioning as a manager, I'd still be very much a people person. I think I'd have a lot more room to grow in those conceptual skills. Um, so how would I function as a manager within my specific organizational structure? So I looked at my hospital, and it's a really big health system, a university health system, and we're the smallest hospital in the group. So overall, we have a very vertical structure. Um, we also use the matrix structure in terms of creating policies and different processes and procedures. We'll have little committees and groups across interdisciplinary groups that kind of can form these policies together. And the nursing aspect of my hospital in particular is very much kind of flattened out. It's more horizontal, where we have just a director of nursing, or CNO, and then it goes right to the unit managers and to the nurses themselves and the units they manage. So that our nursing organization is much more horizontal. So if I were to be a nurse manager within this structure, I think communication would be very important, especially with the vertical aspect, because communication a lot of times can get lost in the mix. So I'd make sure to get the message going both ways, to send and receive the appropriate message to my staff and to those above me. And for the model of care, we use the primary nursing model, and we also have a professional practice model, caring for our patients, their loved ones, and each other. And within that professional practice model and care model are a lot of different values and aspects, collaboration, professional growth, leadership, advocacy. All these things I think are really important. So um, the interdisciplinary aspect of that is very apparent. So as a manager with our professional practice model and our professional care model, I would definitely um, try to incorporate those values and incorporate the interdisciplinary care model. So one of the articles I found is by Pontgross, Milliman, Richard, and Lacey from 2010 talked about the research in um, interdisciplinary care and how there's so many improved outcomes, including decreases in adverse events, increases of staff perceptions on collaboration communication, decreased length of stay for patients, and also improvements in pain management. Um, all these things are an outcome of improved interdisciplinary collaboration. So one of the recommendations the authors had here was implementing programs like Team Steps, which is a communication and collaboration model to help kind of break down hierarchical barriers. I think that'd be really important. So maybe do like regular staff meetings within, say, a particular unit. Try to get the doctors or surgeons at the surgical unit and RMs and the unit manager, get everybody together, if not monthly, at least quarterly. And also multidisciplinary rounding is very important, that we involve case management and the nurses and physical and occupational and speech therapy and the doctor. If we can get everybody together to talk about the physical and psychosocial aspects of the patient, we can help improve the outcomes and the care that that patient receives through our communication and collaboration. So it's really interesting research and article talking about implementing those things. So the Chapter 7 skills in the leadership skill questionnaire. The skills that I would need to secure resources would be definitely communication, first and foremost. Making sure that you can communicate what you need to the financial officers and different boards. Being very detail oriented. If I'm more detailed, I may be able to get those resources so that they know exactly what I need them for, how I'll use them, what are the costs. So being very specific. Organizational and planning skills are really important when trying to allocate resources or staff. You want to make sure that you can show at the upper administration that you have a plan and that we're not just willy-nilly trying to get these resources. There's a need and there's a direction that we're going in. Collaboration is more with communication, and then also just financial skills, financial planning, financial awareness, knowing what the budget is, where can you squeeze out what those extra things that your staff could really use. So those are some of the skills you really need for resource allocation. Let's see, department levels. Who would I need to work with to be an effective nurse manager? Well, in my specific organization, I'd have to work, of course, with my staff, the nurses and the assistants and HUCs, the secretaries and all that. But then also I would work with the doctors, whether they be hospitalists or surgeons. And if you're, so I work on a neurosurgical unit, I'd also get involved with the neurologists, the specialized doctors, or consulting doctors. I'd get involved with managers of other units that my unit is affected by, such as PACU and the emergency department, or so we're a step-down unit. So we often transfer our patients to a general med-surg floor if they don't go home from us. So just collaborating and communicating with those other unit managers would help to improve processes, improve the just flow of the patient from sickness to health. And then of course I'd work with the management above me, the chief nursing officer or director of nursing, and probably the chief financial officer when I'm doing my yearly budget. So there'd be a lot of different people to collaborate with. For my personal preferences, I think that vertical structure is definitely important, especially in really big organizations, having those clear-cut, when you have very defined tasks, when you have very defined roles, clear-cut roles, sorry. It's really important, and the vertical system can help to keep everybody separate and focused on their parts. But when it does come to nursing, I think that a more horizontal structure is advantageous. It allows more room for self-governance of, say, a specific unit, policy adaptation for specific units rather than having just blanket policies that can be dangerous. There's just more freedom for the registered nurses. Could increase their job satisfaction. It affects everything. And definitely for a care model, I think primary nursing is very important. Having that continuation of care, and then having plenty of interdisciplinary collaboration, and having some core values that you feel are important for your professional care model. Well, thanks a lot, and I look forward to hearing y'all's opinion.